Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are focusing on cataract surgery pre and post-operative care. So doctor, my first question for you is, what should I expect during the pre-operative assessment for cataract surgery? Are there any specific preparation do I need to make, doctor?
Number one, see, when the person comes with a diminution of vision, see, we have to see not only the eye in total. See, the vision diminution is because of eye corneal problem, conjunctival problem, or dryness, or because of the lens getting opacification. When lens gets opacification, we call it as a cataract. So depending upon, suppose a person, 80 years old man, retired person, having some amount of cataract, you need not worry, you can ask, it can be postponed. Suppose an active person, leading active life, is working in office, he needs lot of vision, acuity of vision has to be more accurate. Then that type of person, we have to operate in a very early stage of the cataract. So now various techniques of surgeries are available, but before we taking it to surgery, we have to record the intraocular pressure, the corneal condition, what is the dryness, whether he is having a dryness, because if you don't assess the dryness, post-operatively he will have a lot of irritation and he will complain for a long time till his lacrimal system gets adjusted to the newer situation of dryness. Then you have to assess acuity of vision, pressure of the vision, opacity of the lens, where exactly the opacity of the, is it a central one or a peripheral one? Then you have to check the retina, particularly the macula, and we have to, in the history of health, we have to initiate whether it's a diabetic, hypertensive, any cardiac patient, or is on any other drugs which causes bleeding disorders. We have to elicit all the history. Then we have to assess and take him for the surgery. Before surgery, we looked into the lids. We referred the lids, any lid margin like the piece, any hardiolum, or he is having any concretions in the conjunctiva. All this has to be assessed before surgery. Lacrimal sac syringing has to be done to rule out the chronic dactyl cystitis. Otherwise, the person may be you operate and suddenly end up in the infection, endophthalmitis. You have missed that lacrimal disease. So all this has to be assessed before taking. And usually before surgery, we start some antibiotic drops 2 days earlier, 1 drop. And few people, to prevent the meiosis, see, the ones you need a dilatation of the iris before the surgery. See, before doing phacoemulsification or lensex, whatever, you want a good dilatation. So sometimes if you don't use the non-steroidal anti-inflammatory drugs, once you get into the eye, pupil becomes small. To prevent that, we use the non-steroidal anti-inflammatory drugs. Few people use 1 day earlier, few people use 2 hours earlier to the surgery or along with the dilatation. So that prevents the meiosis and surgery will go well. And we take the measurement of the axial length. In the history, we have to elucidate whether the person has gone any LASIK surgery earlier or radial keratotomy earlier. So that we take that into consideration, and accordingly we use the formula to find out the lens power which we are going to improve.
What are the most important post-operative care steps to ensure a smooth recovery after cataract surgery, doctor?
We all allow 2 days. He should take a home rest, not a total rest, to whole rest. He can, for 2 days, he need not watch TV, cell phone. He can talk over the phone, and he can hear the TV, but he has to take some rest. Normal food. We don't restrict any food, but we ask them not to have an advert for at least 10 days. Not to touch the eye. During the daytime, they should cover the eye with the glasses. It can be white or it can be a cooling glass. And during the night time, they have to use the shield so that in the sleep also they should not touch the eye. Then periodically we use antibiotic and cortisone eye drops very frequently, at least for first 5 days. That we use always 8 times a day for 5 days. Then we reduce it to 6 times. Cortisone with the antibiotic. Then antibiotic drops we stop and we start with the cortisone eye drops. Then gradually we reduce the drop to 1 month. Along with that, we give at bedtime this non-anti-inflammatory drops. That will continue for 2 months. And for few people who complain of irritation, we add artificial tears also. We allow them to take head bath after 10 days. And then they can go to their office after 3 days. But they should not be very active. Normal work they can do without touching the eye.
Agreed, doctor, what you said. Are there any common complications after cataract surgery and how they can be managed or prevented?
One is very common cause is the dryness. So dryness because of the two things. One, because we use so many drops that reduces the normal glands that destroy in the who is in the cut. See, the lacrimal gland is not the only gland that secretes the tears, but there are accessory lacrimal glands which help to maintain the tear flowing. That is, we have got a goblet cells, fatty layer secreted by the Meibomian glands, that's the oily layer, and the normal tears over. So these goblet glands get destroyed and they feel dryness. See, we many times we have blamed the nervous. We say the nervous system is nervous supply to the cornea is cut, so that's why the dryness. But actually, it's not the nervous because we nowadays we take only 2 millimeter incision. All other nerves are intact. Only 2 millimeter we cut. But I don't blame that. I blame the frequency of the drops which we use. In fewer countries where they don't use the drops, they give subconjunctival cortisone, which is long-acting cortisone. They avoid using any drop at all. Dryness, inflammation. If the person is having any iridocyclitis earlier, suppose the secondary cataract due to iridocyclitis or uveitis, then he will get a inflammation. So you have to take care of that inflammation by giving atropine or cyclopentolate drops or home eye drops, and then gradually you have to cut down. Along with that, you can give anti-inflammatory tablets also. You can few people give antibiotic drops. With the antibiotic orally also, which reaches the anterior chamber by aqueous secretion. And nowadays the concept is that during the surgery they put some antibiotic drops intracameral, that's in the anterior chamber. But I am not in favor of that because that itself may induce some inflammation. So I give only subconjunctival antibiotic, and after 1 hour we start the drops.
So doctor, your expertise and insights on cataract surgery pre and post-operative care are invaluable to this initiative, and we believe your participation will greatly benefit the patients.